Hello, everybody. Greetings. I'm Dr. Shiliang from China. The topic of my speak today is China experience in controlling COVID-19. Background and purpose. At present, the epidemic situation of COVID-19 is raging rapidly in the whole world, affecting the hearts of billions of people. In less than half a year, COVID-19 swept the world, seriously threatening the safety of all mankind. By COVID-19's damage, the world is bleeding. In the past months, the world has been an average of about 20,000 of new infections per day and about 5,000 deaths per day and continued. Daily new cases per day from World Meet. Daily deaths per day from World Meet. At the beginning, the epidemic was most serious in China, and the strong command of the highest level of the Chinese government, the whole Chinese people united as one, and achieved initial results in the struggle against COVID-19 with scientific prevention and control. The number of new cases in China has been controlled below 100 per day. This is China. Daily new cases from Tonghua-Shi. This is China. Daily deaths from Tonghua-Shi. Summarizing China's experience and lessons in combating the epidemic is undoubtedly very beneficial to people of the world in jointly combating the impact of the COVID-19 epidemic. Experience and lessons learned. Organization and leadership. The state established an anti-epidemic headquarters, which is responsible for the general command and dispatch of human, financial, and material resources throughout the country, and holds regular press conference to keep the people of the whole country informed of the true situation of the epidemic. Local officials at all levels went deep into the front line of the epidemic, connected with the people's hearts, pleased with them, and sharing their destiny. The Ministry of Health of the People's Republic of China established a think tank of senior experts to be responsible for the revision of disease diagnosis and treatment plans, and to update them in practice in a timely manner. COVID-19 diagnosis and treatment program travel has been updated from the first edition to the seventh edition. First edition to the seventh edition. The diagnosis and treatment plan includes the etiology and epidemiological characteristics of COVID-19, pathological and changes and clinical characteristics, diagnosis and differential diagnosis, clinical classification and early warning of critical illness, treatment principle and discharge stance, infections prevention and control in medical institutions, etc. It gives a detailed description in each aspect and points out the direction for the diagnosis and treatment of medical workers across the country. It mobilized the nation's human, materials, financial, and medical resources to support the most severe epidemic in Wuhan, Hubei province. Controlling the source of infection. The source of infection seen so far is mainly COVID-19 patients. People with asymptomatic infection may also become a source of infection. For early detection, early isolation, early diagnosis, and early treatment. For consideration, focus on patients, experts, resources, and treatment. Suspected cases were isolated and treated separately, with early detection of SARS-CoV-2 nucleic acid, and excluded homes were isolated for 14 days. After diagnosis, he was transferred to Square Carbine Hospital for mildly and severely transferred to ICU. Square Carbine Hospital used stadiums, conference centers, convention and exhibition centers, and other larger venues to transform into a temporary hospital that can accommodate hundreds of patients. The patients are admitted to mild patients who have been diagnosed as COVID-19 by nucleic acid detection. Its advantages are that it can be transformed in a short time of 2 to 3 days. It has a large capacity to accept patients, and there are medical staff for diagnosis and treatment, and nurse and health education. While at home isolation, patients don't receive medical and nursing service and are easily infected for family members and easy to cause community proliferation. On February 28, 2020, Ma Xiaowei, director of the National Health and Health Commission, said that Wuhan has built 16 Square Carbine hospitals with more than 3,000 beds actively opened, accumulating more than 12,000 patients. A quarter of patients was treated in the Carbine hospitals. The Square Carbine Hospital has achieved 0 infections, 0 deaths, and 0 turning points, and is truly a carbine of life. Establish a fever clinic. Establish fever clinics in counties and districts. Suspected patients were given SARS-CoV-2 nucleic acid test. It was found that the patient was sent to a designated hospital for isolation treatment. Watch out for infections by medical staff. In the early stage of the disease, Due to lack of knowledge about the disease, a large number of patients followed into the hospital to cause medical runs. Coupled with the shortage of protective materials, extreme fatigue of medical staff, psychological tension, and other reasons, local medical staff in Hubei province, mainly Wuhan city, infected COVID-19 more than 3,000 people. However, since then, more than 42,000 national medical team members supporting Hubei province, mainly Wuhan city, have taken measures such as strict personal protection, national medical supply support, the combination of work and rest of medical staff, a balanced diet, adequate sleep, and intervention by psychologists. The implementation of the method has achieved zero infection, p less than 0.001, and the two are significantly different. Facts have proved that as long as strict isolation and disinfection are carried out and attention is paid to protection, SARS-CoV-2 can be prevented, and even close contact with medical staff can prevent close infection. All measures must be taken to control the initial area of COVID-19, such as searching for close contact, test for SARS-CoV-2, quarantine, treatment for positive cases, close medical observation for 14 days for negative cases, and second nucleic acid test the next day before the negative cases were released for medical observation, and the patients have been to the relevant place such as airports, wharves, shopping malls, hotels, residence area, and families and other places. Strict disinfection. Put out spark, not let it purify. We must nip the epidemic in the bud. The treatment emphasizes the combination of Chinese and Western medicine. The 4-ND and 2 balances advocated by academician Li Lanzhuan's team, and the 3 gems and 3 formulas recommended by Chinese medicine experts of the National and Health Commission played a key role in improving the success rate of treatment. 4-ND, antivirus, anti-shock, anti-hypoxemia, and multiple organ dysfunction, anti-secondary infection. 2 balance, maintain the acid-base balance of water electrolytes and maintain the microecological balance. 3 kinds of medicine: 金花清管 granules, 莲花清瘟 capsules, 许必净 injection. 3 prescription: 清肺排毒 decoction, 化湿排毒 recipe, 宣肺排毒 recipe. Cut-off transmission route. COVID-19 through the respiratory tract droplets close contact transmission is the main transmission route. Since SARS-CoV-2 can be isolated in feces and urine, it should be noted that feces and urine cause aerosol or contact transmission of environmental population. COVID-19 outbreak occurred during the Chinese New Year, and the flow of people was huge. Due to the timely closure of the city of Wuhan in Hubei province, the outbreak of the epidemic was effectively blocked, which won time for prevention and control at home and abroad. According to different epidemic situations in different regions, a hierarchical control strategy is adopted. In high-risk areas with severe epidemics, the strategy of internal non-proliferation, actual prevention, and strict control is implemented. In the medium-risk areas, implement a strategy of importing external defense, preventing internal proliferation. Implement a strategy of foreign defense import in low-risk areas. The city takes community as a unit, and the township takes the village group as the unit for isolation, close management, personal and vehicle entry and exit gate registration, and personal temperature measurement. If you have fever and other discomforts, go to fever clinic for medical treatment. Drive public vehicle, shoot through the street and areas, and repeat broadcast the prevention and treatment of COVID-19 and the medical treatment process so that they are well known. Stop the rally tour, delay the school start, stop the large banquet, stop large-scale culture sports and religious activities. Close public places such as museums and large convention centers. Community and village committees, neighborhood committees, police, and community doctors carry out joint prevention and control. Protection of susceptible groups, men, women, and children, regardless of national skin color. The elderly and patients with underlying disease are particularly susceptible to infection and have a high moderate rate of infection, and protection should be strengthened. Wear masks during the COVID-19 epidemic. People across the country need to wear masks in public places, even in the vast rural area on the edge, even if they are not COVID-19 patients or asymptomatic carriers in the crowd. With a double mask protection between people, the probability of mutual infection will be greatly reduced. Everyone wears masks. The prevention and treatment efficiency is the highest, and the cost is the lowest. Countries in the world must pay great attention to this. Another benefit of wearing a mask is that it avoids the bad habit of scratching the mouth and nose. Masks are based on N95 or surgical mask, but ordinary masks can also achieve effective protection, provided that all people wear masks. The poor regional governments organize supply of masks and distribute them to every household. Wash hands frequently, especially after contact with suspicious patients. You must wash your hands before and after meals, and rinse them with running water repeatedly. Washing hands frequently, hot bathing, individual servings, home office, going out to maintain a social distance of more than 1 meter, eating nutritious food, rich in protein and vitamins. Don't eat wild animals. Strengthening physical exercise and improving physical fitness are all effective ways to preventing COVID-19. Discussion and summary. China's successful experience in controlling COVID-19 is mainly based on the idea of unity in the whole country, strong organizational leadership, and close cooperation with WHO. The country has established an anti-epidemic command headquarters, which is responsible for the overall command and dispatch of the country's human, financial, and material resources. Local officials at all levels have penetrated the front line of the epidemic and connected with the people, breathing together and sharing testing. Carry out prevention first and combine prevention with treatment. The treatment emphasizes the combination of Chinese and Western medicine. The 4-anti and 2 balances advocated by academician Li Zhuan's team and the 3 genes and 3 formulas recommended by Chinese medicine experts of the National and Health Commission playing a key role in improving the success rate of treatment. Special emphasis is placed on 3 points. First, all measures must be taken to control COVID-19 initial areas following close contacts. Contact SARS-CoV-2 test. Positive patients shall be isolated and treated, and negative patients must be close observed for 14 days. Strike these factors relevant place passed by patients, such as airports, doctors, shopping malls, hotels, residential quarters, and families. Extinguishing the fire of the stars is not allowed to catch a fire, and the epidemic must be wiped out in a budding state. This is a great significance to the prevention and control of the epidemic situation in the country, where COVID-19 was first released, and the region where it was first released in the same country. Second, wearing masks is simple and convenient, and its prevention and treatment effectiveness is first. Especially medical personnel shall be struck in place. Why is some countries' incidence rate high? Transmission is wide. The reluctance to wear masks is the main reason. The painful lessons must be recommended and corrected. In Chinese communities around the world, why the incidence rate is low? In addition to being taught by relatives and friends in the mainland, wearing masks is the primary reason. Everyone wears a mask. The prevention and treatment efficiency is the highest, and the cost is the lowest. Countries in the world must pay great attention to this. Third, strengthen the protection of medical personnel. Medical personnel are the main force in the fight against COVID-19 and the value asset of the country. The main cause of close infection in hospital also, so they must be strict protected. It is necessary to provide qualified and sufficient protective materials, abide by strict disinfection and isolation regulations, ensure adequate rest time, maintain good physical and mental health, and create an atmosphere of respecting doctors. Pay tribute to the healthcare workers of the world to fight COVID-19. As long as people all over the world unite as one, scientific decision-making, prevention is first, prevention and treatment are combined, and we will continue to gel and learn from successful experience of all countries in the world, combine our national conditions, and use the wisdom of all mankind to deal with the common enemy SARS-CoV-2 and COVID-19. We can definitely win this people's war against the epidemic. Dr. Tenders, Director General of WHO, National Unity and World Unity, we are all united and we will be able to defeat COVID-19. People all over the world unite to fight against COVID-19. The world will have a better tomorrow. Acknowledgement. I thank Professor Xiao Jianyao, an international virologist, Professor Jian Jing, a member of China's COVID-19 expert group, and Cao Zhao, chief physician, put forward some good suggestions for this article. Post-Dr. Ning Xu contributed to the writing of this article, and my wife, Fenglan Huang, Deputy Director of the Nurse, to do a good job logistics support this work. I want to thank all the experts who fought against COVID-19 and the Chinese doctors and nurses. Your hard work has successfully prevented popularity of COVID-19 in China. Wish the world peace and people happiness. Thank you.